think we're booting up. Hello, good morning. Or good afternoon, depending on where you are, and certainly good afternoon in India, isn't it? I'm Barbara Stilwell. I'm the Executive Director of Nursing Now, and I'm delighted to be able to join this really significant event today, where we're celebrating 1 year of the Nightingale Challenge. It's been an extraordinary year, as you will have heard many of our speakers say. Who could have predicted that the year of the nurse and the midwife would be a year like this one? However, and maybe because of that, we have signed up almost 30,000 nurses to the Nightingale Challenge. And we're thrilled and delighted. And one of our main early adopters has been India. And today, we have a great mix of speakers for you. You can see all their profiles on the web. Because we have a few speakers, I'm not going to spend time now introducing each of them. But welcome to all of you. We're delighted that you're able to join us and to share some of your stories with us. We have a mix of private and public organizations, some colleges, and a Nursing Association of India. We will hear about their experiences in implementing the Nightingale Challenge, what they've learned and the lessons they can pass on to us. So this is a fantastic opportunity for all of us to learn from what's been happening in India. Please share your questions in the chat box. And I think, Anthony, can they share it on the Q&A as well?
Yes, you can either share it in the chat box or use the Q&A function, which is there as well.
Great, and Anthony and I will monitor that as the session goes on and introduce the questions as they come in. But first of all, I'd like to introduce Anthony, who's one of my core team here in London. Been working with us for a while and on the Nightingale Challenge. So Anthony's going to introduce the statistics, the figures relating to India as to get us going. Thank you, Anthony.
Thanks, Barbara. Hello, everyone. Welcome to this session. Thanks so much for joining. So hopefully you can all hear me and see the screen.
Yeah, could I just say, if you're not speaking, could you mute yourself? There's the mute button is on the left-hand side as you look at it. Thanks.
Brilliant, thanks. So yeah, as you can see on the screen, here is the makeup of all the countries who have joined the Nightingale Challenge. You know, a big, huge spread across the world. And there are 74 countries in total, I believe, who have signed up, and more are joining all the time. In fact, this week we just had South Korea send a number of hospitals signed up. So that's all very exciting. But by far and away, the biggest numbers and the biggest turnout we've had for the challenge has been in India. So out of the total Nightingale Challenge numbers of 28,363 nurses and midwives from 744 organizations in 74 countries, over 8,000 from 200 organizations have been in India, which makes up almost 30% of all the Nightingale Challenge participants. So yeah, it's wonderful how India has really taken to this challenge. And let me show you. Yeah, so as you can see across this map, the spread is really across the whole country. I don't have the state data by state, but you can see there's a really good turnout across there, and that's sort of from the Ministry of Health, from the Indian Nursing Council, from large health providers, private and public, from nursing associations to, you know, small clinics and nursing colleges from across the country. And here's just a closer up view of the sort of north and eastern regions. And then around the central and in the south. So if you want to see this map, this is available on our website in the Nightingale Challenge participating organizations section. You can actually have a look and see all of these individual signups. And I'll post that link in the chat box so you can check that out yourself. So, thanks very much.
Thanks so much, Anthony. And that's it's so impressive the way that India has really taken to this challenge. And I hope we're going to learn from our speakers, you know, why the motivation is so high in India for this. It's amazing that, you know, it's what, a quarter of our participants are from India, Anthony? Is that about right? Of all of them?
About 30%. Yeah.
30%, yeah. So, I mean, that's astonishing, isn't it? So let's learn from that. So our first speaker is Dr. Annie Grace, who is from the Tamil Nadu Nurses and Midwives Council. You have an ambitious target, Annie Grace, of 5,000 nurses. It's huge. And you are using an approach called LEAP. Yeah. So I wonder if you'd tell us about LEAP, tell us more about that, and tell us about how you recruit and deliver training to that number of nurses and how you maintain quality. We'd love to hear about that.
Okay. Good morning to one and all. I bring greetings from Tamil Nadu Nurses and Midwives Council on behalf of our council members and the nurses of our state. And it is really heartening to see all of you on this platform. And as Ms. Barbara has told, that we have taken a real ambitious challenge to train 5,000 nurses below the age of 35 years. Actually, the Tamil, first of all, I would like to give a little brief about our state nursing council. It is the premier nursing council established in 1926. It is 92 years old nursing council, under which we have approximately 170,000 active live registered nurses are there. And when we heard about the Nightingale Challenge, we thought we have to really take it up this leadership skill to all our nurses across, because mostly the Tamil Nadu and southern part of the hub is the nursing educators hubs, and so we thought we can do it very well. So we decided to train the TOT from all the nursing colleges. From 190 nursing colleges, we recruited two nurse educators, and we given them TOT by the way we prepared PowerPoint slides on 8 topics regarding leadership skill. And excuse me, Mr. Anthony, would you allow me to share my slides if you don't mind? Mr. Anthony?
Yes, absolutely. Go ahead and share your screen.
Yeah, okay.
There you go.
Yeah, right. So you can see here, yeah, thank you. This is, it's not moving. Okay, I'll just talk because it's stuck, I think. So we have prepared 8 topics on different aspects of leadership skills, and we have worked out, and we have in Tamil Nadu around 32 districts. So we decided in each district 3 times the turnover. For example, January, 10 districts we have taken it up. Each institution being chosen, and from there across that area, the institution will pass on the message to all the small to medium to large scale hospitals and request them to sponsor them for this leadership skill. So we have given a designated proper sponsor letter, and so they have been sponsored from the concerned hospital, from their institution, and from there they can they joined this LEAP program. This LEAP is nothing but leadership excellence and leadership excellence academic program, which is given for all the nurses below 35 years. So the nurses who are trained here, been morning they have called up, and this is the standard schedule we followed. Actually, this is the one you can see on the side. This is the standardized module throughout the state, across Tamil Nadu and Puducherry. This is the 8 modules. The resource person who have been trained on these topics, they were be the resource person taking classes for those people in that area. So here you can see here, this is how we planned on the 32 districts. This is the expert group who designed that standardized plan to implement. And this is how we were able to do these things from each month. You can see from Coimbatore, you can see, if you see February and March, we could do. And from March, it has been withheld. And so far, up to March, we could able to train around 1,323 nurses being trained from different 30 districts of our state. So because of COVID-19, and we are unable to cover the remaining part, and so with this method, we could cover 264 hospitals across Tamil Nadu, from small to medium to large hospital. So the nurses who are benefited so much, and we have given a pre-test and a post-test to the nurses also, and we could see a real a changeover of knowledge, of leadership skills. From when they were initially joined, they were having adequate knowledge of 40% and inadequate of 45%, and they moved to 82% at the end of the day, and overall consolidation report of this 100,323 nurses, and among which majority of female nurses and only 36 male nurses who attended this program. So this is how we formulated this whole LEAP program, and we worked out and we rolled out for the every month. So the plan is given for whole 10 months to each institutions, and by then they all been covered up. And every day, it is a one day from 8 a.m. to evening 5 p.m. and the same schedule been followed throughout Tamil Nadu. Same, we have formulated a vote, leadership vote, standardized vote, so that they could feel that they are taking some oath and they are coming out as a leader. And whether they are a boss or a leader, they can plan, they can think it over. All that was planned and done in a very beautiful manner. This from here you can see from March, we till March we did it, but still we couldn't cover up 1,500, because every institution should give 50 nurses training below the age group of 35. But we could cover only 1,324, because in by middle of March we all faced with the challenge of COVID-19 crisis. So this is how we implemented the standardized plan of working out of our program by the experts, by the TOTs who have been trained in this module. This is a glimpse about how we rolled out and how we are ambitious now. Now, though we stuck up in between, we are making this LEAP module as an online CNE module with the credit cover, so that the nurses who are not able to attend, when they get a time in future, they can attend. But today morning, I was very happy to hear it is till 2021 Nightingale Challenge goes on. Still, I can think of that human touch of direct resource person and contact workshop of LEAP. This is the in nutshell about the team, how we rolled on. Thank you.
Thank you so much, Annie Grace. That was a fascinating look, and my goodness, you have your work cut out, don't you?
Yes.
Gosh, with this, what an agenda! All of those places, and I love your LEAP approach. Have you shared that? Have you published about your LEAP approach?
Basically, as I told you, we have trained 200 TOTs that train the trainers. So from there, we have under council, we have 190 colleges. So every district has 2-3 colleges. From that colleges, I made that up. And from their colleges, they have to contact all the small and medium level hospital about the LEAP by a pamphlet, so that and also they went and approached the chairmen those who were not willing to sponsor. They went and spoke with them, and they got the sponsors, and they attended these workshops.
Fantastic. Thank you so much. I really admire your organizational skills and your enthusiasm, Annie Grace, for getting this done. It'll make a real difference. Now I'm going to ask Professor Suresh to talk to us. Suresh is from the All India Institute of Medical Sciences in Rishikesh, and has a very interesting program for Nightingale Challenge. We know, Professor, that you're a writer on nursing with a special interest in nursing leadership. So what are the lessons we can learn from your experience so far? And should we be encouraging investment in nurse leadership in this way? Welcome and thank you for being here.
Thank you, Barbara. May I request that may I be allowed to share my screen?
Yes, I think you have a little button down the left-hand side as you look at it, a screen with an arrow. Can you see it? And if you press that, you should share your screen.
Yes, Barbara, I'll do that. Thank you.
Okay. Is it working?
Yes, Barbara, it is working. Just a couple of minutes.
Somebody somewhere has some hammering going on. If you could mute, if you're the person with the hammering. Thank you.
Barbara, I think I'm finding it difficult to share my screen.
Okay.
I'm just trying once again. Probably this time I'll be able to do. Yes, just
Suresh, it is difficult to share and talk. There is some problem in that. Even mine, it was not moving.
Okay.
Oh, really?
Just a minute. I'll just try. Otherwise, I'll continue speaking like that.
Yeah.
Fine. Anyhow, I'm finding it difficult to share the screen, but I'll continue. What we did that my institution is a new institution. This is started in 2012, and we had a brigade of young nurses with us. What we thought that let us develop a leadership skills among them, and what we did that we brought up this by two ways. One thing is we a focused training program for them, and mentorship, shadowing, and giving a special leadership task to them. And what we did that we have identified a system where we have taken up the people who had leadership attributes and qualities. We give them a specific training, and we have given them a task to develop leadership skills, and they have come up very well. Like the team leadership concept we have infused at every unit and ward, where they could show us the innovations in doing a management of a particular unit. In addition, we have brought up the few young nurses who are at grassroots level to the top administration to be under the shadow of the actual leaders, and then implement their own innovations and leadership qualities, so through which they can develop the leadership qualities, and their new ideas and energy can benefit into developing our own system and infrastructure. What we else did is that we brought up few nurse-led initiatives, like nurse-led diabetic follow-up clinic, where once the physician assess a patient, diagnose a diabetes, prescribe the medical treatment, thereafter nurse takes up this patient, educates him about the anti-diabetic drugs, insulin, and then do the follow-up of every fortnightly. Patient only goes back to the doctor if there is any sign of development of complication. Otherwise, that patient remains with this nurse-led diabetes follow-up clinic, and she manages these patients to prevent any diabetes-related complications. In addition, we have also implemented nurse-led palliative care initiative. We have large number of patients coming from Western UP and Uttarakhand for some specific cancers like the cancer of gallbladder and breast cancer. And these patients are coming to us in stage 3, stage 4, where they are late diagnosed, and palliative treatment is the only option. And nurse takes a lead into it and then follow these patients and keep them into as much as comfortable position till they take their last breath. So family and patient, where family is trained to take care of this patient at home and gives the support 24 into 7. We are also in phase to implement a nurse-led stoma and wound care clinic, where anywhere in the hospital where the wound, the nurses will take care. In addition, these initiatives, we have large number of postgraduate qualified nurses joining our hospital. So what we thought, we are anyhow giving them 1 or 2 extra increments. So we are going to utilize them for specialist nurses or clinical nurse specialists, and we are going to have a training. Our honorable director had a vision that we will train them as a nurse practitioner, and they will be taking care as a role of clinical nurse specialist, which is there in the Western world. We also have plans to start the advanced nurse practitioner programs, as Indian Nursing Council has already launched the nurse practitioners program in critical care nursing, which we are going to start very soon in our institution. And these trained nurses we are going to absorb in our own hospital, uh, and utilize their services to have a specialized care in critical care. And subsequently, once the Indian Nursing Council brings the primary healthcare practitioners program, we would like to have in our institution. So this is the way we are going to move forward, and these are the some initiatives we have taken into our hospital and institution. But we have few restrictions. If we look into the region and country and whole, we have restrictive government legislation and regulation. At the moment, Indian Nursing Council has taken initiatives. Honorable President Indian Nursing Council is with us today, Sri Dilip Kumarji. He's going to highlight more about it. What I know about it is that Nursing Practice Act is framed and tabled, and we are waiting the Nursing Practice Act to come. Still, the state nursing councils, which are registering nurses, are only have a limited powers to control practices. They have predominantly controlling education system, where nurses are only registered as a registered nurse and registered midwife, but this nurse practitioners or specialist nurse which are coming out has no defined role. And our country and this whole region, Southeast Asia region, is a male dominated region, and female the nursing is a female dominated discipline. So socially the recognition is still yet to come. We in being a gender dominance as a male, that leads to the medical fraternity dominance into discipline, and whole healthcare system is a doctor driven, not the nurse driven. And nurses has a very limited powers, either it is a ward level or it's an institutional level or any other capacities. Our training need to be uh, have a system of getting from submissive to the empowering model, and our training into leadership is limited. We have the course, but practical training into leadership has to be enhanced. How we can increase investment into nurse leadership tomorrow? We need to create a successful model for benefit from nurse-led systems. As I told you that we had taken a nurse-led diabetes follow-up clinic and nurse nurse team-led ward management system. If these systems will be uh, show the benefit, we publish them, we publicize them, then government may take a note of it, and these systems can be replicated countrywide. The India has taken an initiative of bringing community health officers by giving them specific training. And now this specific module has been incorporated into BSc nursing itself by initiatives of Indian Nursing Council. Now the nurses who are passing out are taking up a role of community health officers. If they show the success story, the government may take initiatives and can give them a lead into health and wellness centers, which in large number the government is going to open. For which what we need to transform our education system. We need to transform the cadre system. We have a nursing officer, senior nursing officer, and then they get into lead administrative channel as a assistant nursing superintendent, DNS, NS, and CNOs. However, we need to create the cadre system for the clinical nurse specialist, advanced nurse practitioners. This cadre will be reformed, and new cadre will be there. The nurses will have the multi-dimensional, and a system to function in healthcare system. We also need to transform our directorates because they are predominantly dominated by the medical fraternity, and nurses has very limited power in directorates at either state and central level, and these need to be transformed. And there's a transformation of the State Nursing Council Act, and State Nursing Council acts must have a education and practice both components, because all nursing council acts are way old, and they are just copied from one to other, and they need a serious transformation. To have this transformation, we require a serious political lobbying. We require collective bargaining through our nursing associations and societies. And I'm very hopeful that this nursing challenge and nursing now initiative, the small initiatives at every level, at institutional, at state, at region, and at countrywide, is going to bring up fruits for nurses to empower them, and they will be able to provide the better health and a good quality health for people of this nation. Thank you very much listening me patiently.
Thank you, Professor Suresh. That was fascinating, and you're raising issues, I think, that are relevant to everybody around the world. As nursing practice evolves and becomes advanced practice, how do we reflect that in scopes of practice, in education, and in the respect for nursing that other health professions have? So thank you so much for that. Very suitable as to be applied in many settings, I think. So now I'd like to introduce Dolly Biswas. Dolly is from the Fortis Healthcare in Kolkata and is the CNO there. Dolly, what do you think? Tell us about your experience of the Nightingale Challenge, and what do you think have been some of the benefits of that for your organisation? And you've got 5 minutes. Dolly.
Yes, ma'am. Thank you, Ms. Barbara, and the panel members on the screen. Good afternoon to all of you. And I am working as the CNO of Fortis Healthcare in Kolkata, and I'm glad that I have got the opportunity to participate. Yes, through the Nightingale Challenge, the Fortis is doing a great work. Approximately 18,000, almost 18,000 nurses are working in entire Fortis Healthcare, and there are plenty of programs which are going on to prepare the young nurse leaders in Fortis Healthcare, and these are the leadership training, supervisory skill development, where we train our young leaders, those who are smart, having a good knowledge. We fix them up and train them on assertiveness, leadership, communication, interpersonal relations, problem solving approaches. So all these continuous training are being given to prepare these young nurse leaders. The career pathways are being explained to them. So once they acquire 4 to 5, 6 year experience in the healthcare, we promote them in the leadership positions, like in charge of the particular department, supervisor of the department, and also preparing them to lead different clinics like respiratory clinic, colostomy clinic, diabetic clinic, and they are doing a great job in it. So these kind of trainings are happening in entire healthcare. These young nurse leaders, they are also taking the responsibility to do various audits which are required to maintain the quality healthcare in the organization. So to meet the standard of nursing, I mean the National Accreditation Board of Hospital and Healthcare Provider, that is to get the NABH accreditation in India, the healthcare organization that are applying for it. Mostly the surveillance, the audits has been carried out by these young nurse leader, those who have been prepared. Accreditation like nursing excellency to understand the status of nursing care given to the organizations by the nurses. So every audit, as well as the new standard which has been developed by the Infusion Nursing Society of India, the standard known as Infuse, to maintain the safety of infusion practice. Thus, to get the certifications, we have to apply for this particular certification, and the audits and everything has been done by this young nurse leader. So there are plenty of steps. Training has been taken place in the Fortis Healthcare to train these nurses. Now, a little bit, I would like to highlight in this pandemic COVID scenario, where these young nurse leaders are doing an excellent job. So, to train, to handhold the newcomers, they are taking continuous rigorous training, maybe as an infection control nurse, as a quality nurse, or a senior in charge, or a nursing in charge supervisor, second line in charge. They are training the nurses continuously how to care of the patients with COVID-19 positive cases in the intensive care unit, in wards, and also preparing different small videos to train and to circulate amongst the young nurses how to don the PPE, doff the PPE, what type of infection control practices that they have to follow. So these young leaders are taking a great initiative and doing in entire healthcare network. So as well as, in Fortis Healthcare, we are training our nurses, as madam said, there is a leap is in a different nomenclature, they are using it to train the nurses, but in the Fortis Healthcare we are also using a leap to train the nurses, that is to develop or to maintain the quality health care or to maintain safe practices in the hospital. We call LEAP, that is listen, empathize, action taking, and problem solved. So listen to the patients, listen to the relatives, to understand their pain, to understand their problem, and empathize with them. Give them some time how we can solve their problem, and definitely there will be certain aspects which we have to take in account to solve them. So these young nurses leaders are taking part to do so. So with this, I would like to complete the talk mine. So thank you that taking different initiative to train these young nursing leaders in this Nightingale Challenge initiative. Thank you so much.
Thank you, Dolly. That's really inspiring to hear how these young leaders are stepping up, particularly in this time of COVID-19. And, that's what leadership's all about, isn't it? It's about being resilient and, yeah. Can you hear me? Yes.
Barbara, anything else you want me to say?
No, that was great. Can you hear me, Dolly? Can you hear me? Anthony, can you hear me?
And hello.
Hello, can you
Yes,
hear
sir.
me? I'm
Yes, sir. I
speaking.
can't hear.
Can't hear.
Hello.
Hi, Barbara. We can hear you, and we can
Can
hear
you?
Dolly as well. Yes, please proceed.
Okay.
Yes.
Okay. Good. Thanks.
Barbara,
I'm not sure
would
Dolly
you
can
like to
hear me.
ask me anything else?
No, thank you, Dolly. I'm not sure Dolly can
Hello.
hear me. Thank you, Dolly.
So,
We're going to move on. We're going to move on now to talk to
I can't
Professor
hear.
Punitalakshmi, who is from the Jait College in Jodhpur, I think, is it?
Yes, ma'am. Yes,
Hi,
yes.
So if you could tell us, please, to your
Hi,
approach.
Barbara. I think I have completed my talk because I have been given only the 5 minutes, and I have done
Yes.
it with the leadership programs that we have taken up to train our young nursing leaders, and I have spoken about it, the initiative that we are doing in Fortis Healthcare, and we have almost trained many nursing young leaders to combat with the present scenario, as well as taking the leading positions to maintain the standard and quality of healthcare.
Yes. Thank you, Dolly. I'm sorry. I don't think Dolly can hear me. If anybody else can.
Yes, we can hear you, Barbara.
Okay. I don't think Dolly can. Anyway, I'm going to move to you, Prof, from Jait College. Please.
Good afternoon.
Good afternoon.
Good afternoon to all. It's a great, immense pleasure to share the stage with the experts from India and global. And thanks for the opportunity you have given, and happy anniversary to all of you on behalf of the Nightingale Challenge. Today's topic of my approach to develop the Nightingale Challenge program. Nightingale Challenge has given ample amount of recognition to the noble nursing profession all over the world. The approach was mainly focused to prepare and train nursing professionals to be more competent and skilled, to provide them with all sorts of knowledge and necessary resources, and also to remove any type of obstructions that would potentially become a hindrance in the optimal growth and excellence achievement for nurses. So, moreover, this challenge needs to be tailor-made for different situations and working environments of nurses. Like in India, if you see, the nurses are a growing and underrated part of the vital healthcare sector, as Professor Suresh sir was saying. So this is the true thing what we are facing, the difficulties over here. And there needs to be more planned and structured training programs that aim to bring all the nursing professionals on a global norm. Nowadays, we all are trying to do that, and all the highest people are there. Our honorable president is there, Suresh sir is there, Annie Grace ma'am, and everybody is doing on that basis, and we are also following that. And proper motivation and appreciation will surely be helpful with a respectful pay scale for all nurses equally. That equal pay scale is not there, so that itself making the nurses to become frustrated and they are not giving the full job. So that is the another thing. If you see in 70, 80, 90s, it was service oriented. Now it has become job oriented. So while taking into consideration of all these matters, specifically in Indian setup, my approach is okay. Now we have started. What are the things we are doing? It is knowledge enhancement through virtual platforms, clinical competency development, capacity building, especially in the light of current pandemic, making next generation leaders through leadership development programs. We have conducted a webinar on LEAP, again, leadership excellence and professionalism. We got more than 800 participants for that. It was a great success what we have did it, and we were able to bring changes with the young nurses. So next is the conduction of more clinical research, what we have taken up, and we are including the faculty, the staff, of the hospital, and along with our students, we are doing the researches, and that is another thing. Next is evidence-based practice to improve the quality of patient care. So we are giving training for the students in various specialty hospitals continuously with the monitoring of and with the research process also. Empowering students with a wide range of practical based curricula. For example, now COVID has come, so education on it and training on it has been given. So, like that, whatever is needed, we are doing the things and making use of innovative technologies for teaching, learning activities, research, conducting virtual educational programs like webinars. Like nowadays, we are habituated to those online classes and webinars what we are conducting continuously, and it is a great thing what we are having it, and we have done on compassionate listening also. So as in the first session of 1:30, so all these things we are doing it, and through this thing, and apart from that, we are having in our college the mentor mentee training program also. So all these approaches we are doing it for our institution, and what I have been doing it over here. And if you ask for the advice to other organizations for considering implementing the Nightingale Challenge, well, you can know as this whole challenge emphasizes on building the standards of nursing as a profession and set up a new benchmark. The organization, those who wanted to take up the Nightingale Challenge, should look forward to adapt and implement the challenges, should focus on fulfilling the prerequisites for this, which would be multiple activities to engage the current file of professionals. Okay, like medical camps and work coaches can be them. And they can make up arrangements to broaden the horizon of knowledge and skills, like seminars and workshops can be done with the things to enhance their knowledge and skills of the student, of the young nurses, okay, where they are supposed to get trained up and boost up the morale, confidence, and make the nurses take a pride in what they do. Okay, first of all, as in the compassionate, think about yourself. Okay, make yourself compassionate. Okay, all these things has to be started, and you have to give them the encouragement, appreciation, so automatically they will be motivated to do it. So all these things can be my advice for the organizations, those who are taking it. Thank you.
Thank you so much, Professor. Some very good tips there and ideas, and we're getting some nice feedback in the chat box about everybody, how useful your presentations are, and that people are learning from them, which is exactly what this is about, and we really echo your ideas on compassion. So we have two more speakers. So I'm going to introduce Shatrughan first, Shatrughan Parikh, from who is the nursing superintendent at the Indian Railway Health Services. Is that right?
Yes, ma'am.
Yes, and we would love to know from you, what do you see as some barriers to developing nursing leadership? And how have you applied the Nightingale Challenge from where you are? And then we're going to introduce Dilip to round us up in this session. So, Shatrughan, to you first.
Thank you, ma'am. Good afternoon, all. And I'm very blessed to have all that respected panelists in front of me, and I get the opportunity to just present the barriers to develop the nursing leadership program in India and at the global level. First of all, I would like to say that Indian Railway nursing services is not as much as explored compared to the we can talk to AIMS and the other organizations. So we have a little bit restrictions in our institutions, and as Professor Suresh Kumar Sharma says that there are this specializations in the AIMS, but we have no specialization in our railway nursing services. So taking these all points in our mind, we plan a program so we can develop the leadership skills in our railway nurses. So that program was planned for one day. It was basically on the theme of the warm to tomb, as we nurse provide the care to the patient. So in that, we discuss on the role and responsibilities of the nurses for the patients, because without the role and responsibility, we can't develop the skills and power in the healthcare professionals, and without the power we can't lead our fraternity. So taking these all points, we recruited 150 clinical nurses, academic nurses, and student nurses for this program to explore the things. And this was a challenge taken by us, and then it was converted into the Nightingale challenge. So in our program, actually we face some barriers. The first was the lack of autonomy and the authority is given to the nurses, as Dr. Sharma says that nurses are nowadays limited only to the ward. They are not getting the more autonomy and the power. Another thing is the a lack of the manpower is also there. So they are not doing as they are assigned for their work. Next is the no uniformity in the nomenclature, because as we think they are in the different areas, there are the different nomenclature. So it is sometimes it's create the conflicts of the role of the nurses, and also in the leadership. Uh, Next is the policy and the strategy paralysis, which is I think is there, because a limited involvement of the nurses in the policy and strategy making. Even it is made for the nurses, but still the contribution of the nurses are so limited. Next we talk then the we have no dual role policy, especially in our railway nurses. So a dual role policy should be as work as a barrier in developing the nurse leadership. Then we nurse practitioner, nurse clinician is not existing in the most of the countries. It's also inhibited the nurses to become a leader. Then we are facing the problems like poor utilization of the qualified nurses in the clinical and the teaching according to their specialization, because sometimes we have seen that a person from the medical surgical and he is posted into the pediatric wards. So it's these things hamper that developing the leadership skills. And next is that because nursing is always as a independent profession, but still it is considered as a subordinate profession of the medical. So the recognition to the profession is still not given, which is developing the hindrance in the leadership.
Thank you, Shatrughan. I'm going to have to cut you off there because we're running short of time, but you've raised some really important points, and I think it's we do need to give some time to Dilip. So I'm sorry to have to cut you off at that point, but we'll get back to you about another way of sharing this information. Dilip, can I bring you in to close us? There have been lots of important points raised about scope of practice, some of the barriers, gender-based barriers, education. Over to you to close this session for us.
Good morning, good afternoon, good evening to everybody.
Morning.
First of all, I would like to congratulate Nightingale Challenge for initiating very important program of 2020 as a year of nurse and midwife. I think the first question I would like to answer for the question which you raised, in India, 30% of the nursing and midwifery professionals would log on to Nightingale Challenge. The answer is Lord Nigel Crisp physically visited New Delhi, and we had a half-a-day consultation under the invitation of the Federation of Indian Chamber of Commerce. So that gave a big fillip, and a message has gone across the India. Another important the message which went from the national level is Nursing Now campaign was launched by the Indian Nursing Council under the leadership, the political leadership. The Minister for Civil Aviation, Suresh Prabhuji, and 2 member of parliaments, they were there, and also in the presence of our present ICN president, Leslie, and very important key leaders were there while launching. That has given a spinning of effect all over India, and the number of letters the Indian Nursing Council wrote to the various employers. I think we believe that just giving a continuing education type of a program of a one day attending a participation of some of the courses is not going to facilitate to develop the leadership skills. The leadership skill is a very, very difficult, and an environment, enabling environment has to be created. So therefore, we have a different types of leaders. And in India, being 30% of the healthcare delivery system is provided by the public sector, 70% of the healthcare delivery system is provided by the private sector. Out of that 70% private sector, about 15 to 20% from the corporate sector. So we have a different level of healthcare delivery system what we have. So therefore, I think after having a different consultation from the various nursing experts in India, we found interacting with the ICM, the leadership for change, LFC, is the ideal solution for developing the leadership skill. You know, we had a lot of deliberation with the ICM, and April 20th was the date was fixed for having a master training program in Delhi. The Qureshi was supposed to travel to start the LFC training program in India. Due to COVID-19, it has been postponed. So what we are going to do is, yes, now we have in this 1 year, we have created a lot of awareness program about the Lord Nigel Crisp's view. I think this is a nursing profession globally has got an opportunity, lifetime opportunity for increasing the profile of the nursing professionals and recognizing the role of the nursing and midwifery professionals. And again, this COVID-19 has also given an opportunity for the nurses. The role was been appreciated. Even in India, the Prime Minister of India could talk to one of the nurse and telephonically appreciating and motivating how the nursing professionals are taking care of the COVID-19 patients. And also the government of India has come out with 2 very important insurance scheme for the health workers. And that insurance scheme is helping the motivating the nursing healthcare workers, including the nurses, and also the zero tolerance. A law has been enacted. I think last week I shared that enactment of law to the ICN CEO because he wanted to know this enactment of law. I have shared that law to the ICN, and he was telling this is one of the best law which has been zero tolerance, which has been enacted by the government of India. So now the enabling environment has been created, and we would like to train under the LFC at least 3,000 leaders in India from each state. At least 10 to 15 people we would like to train. So those people are going to be the leaders. That's a leaders LFC program, which is one of the brand program which has been implemented successfully in 40 countries through the ICN. So we are bringing that whole program to India, and we'll be training the 3,000 people. And also because of the COVID-19, we may start a little delay in starting that program. In the meantime, we have signed an MOU with the Symbiosis Management Institution. So the management institution and the Indian Nursing Council is going to run a management programs through webinars, so that at least knows, because that Symbiosis Management Institution has been considered to be the number 4 in the at the top level in India, and that is going to create awareness and sensitization of the leadership skills to the many of the nursing professionals. And then the scope of the another important development, which is one of the problem which we are facing, is our regulation. The regulation is the existing regulation is only covering for the educational system, not for the practice. So therefore, we have already framed the amendment of the Indian Nursing and Midwifery Council Act, and that has been already, it has been placed in the ministry, and hopefully within a year. And in that amendment of the act, the scope of nursing and midwifery practice, which was not there, it has been reflected. Once that is approved, then our nurse practitioner critical care program, nurse practitioner midwifery program, all these advanced nurse practitioner program which have already launched. So then they will be able to, they will be legally empowered to practice them. So that is one of the big momentum which is being created. And with that, another important thing is this state of the work zone report, state of the world nursing report is definitely, we have already written to the Ministry of Health to constitute a high-level expert group to study the recommendation of the state of the world nursing report. And the state of the world nursing report is covering all the issues the nursing profession at the national level and the global level which is facing, which is going to have a solution for the many of the things. And we have to involve the political representatives. So that's how we are requesting the Suresh Prabhu is one of the ex-minister, is going to chair this committee, and under his committee task force is going to study the state of the world nursing report. And he being one of the health committee in the parliament, he is going to take up this issue in the parliament. In that level, we are trying to mobilize the political level, so that once, if we are able to create a momentum at the political level, the investment, while I was the chief nursing officer of the India, we were able to get a high in the 11th 5-year plan. Their budget allocation for the nursing has been increased tremendously, and going down. Now we have to see that how best we can see. Without budget, you will not be able to make a difference in the development of the nursing services at the state level and also at the national level.
That's absolutely it, Dilip. And we're out of time, but that's a perfect note to end on. Without the budget, we can do nothing. So what we need to be all doing is lobbying for investment in nursing around the SON recommendations, State of the World's Nursing Recommendations. As you say, Dilip, so important. I want to thank you all, and again, apologies to you, Shatrughan, that we couldn't finish with your presentation, but we will find ways of capturing all the lessons you're learning in India, perhaps do a special feature on you on our web pages within the next year. So thank you from all of us here for such a fantastic and rich session. I wish we'd had 2 hours instead of 1 hour, but thank you, and I hope we'll be seeing you in the near future. Thank you so much.
Thank you.
Thank you. Thank you. Thank you so much.
Thank you.